Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Always great information from Covenant. Joining us this morning is Nurse Cindy Bailey. Thank you so much for being here. How are you?
I'm good. Thank you for having me.
Of course.
I'm happy to be here.
We are delighted that you're here. Thank you so much. So today we are talking about fighting breast cancer with early detection. So why, Cindy, are screenings so important in the fight against breast cancer?
So screening mammograms are important because it's the best way for us to find breast cancers at the earliest stage possible. With the technology that we have today, we have what's called a 3D tomosynthesis mammogram. So our radiologists are able to look at the imaging of your breast, and it's a 3D image, and we're finding breast cancers at very early stages with these screening mammograms. We are detecting breast cancers before a woman would even have a sign or a symptom.
Wow.
Before you might even be able to palpate a lump with a self-breast exam, or maybe even before your doctor could feel a lump on a clinical breast exam. And what we do know is that the earlier that we can find and catch breast cancer, the easier it is for your doctor to treat it, the easier it is for your doctor to manage it, and you have an overall increased survival as well.
That's right. Early detection is definitely key in fighting breast cancer. And what a detailed imaging that you have there. We love to hear about that. Now, Cindy, it's all about pink this month. October is Breast Cancer Awareness Month. So what are the current recommended guidelines for screenings and mammograms? When should people get those?
Yes. So at our Covenant Breast Center, we follow the guidelines from the American Society of Breast Surgeons, and those guidelines recommend that women women who are of average risk for breast cancer should start getting their screening mammograms at the age of 40, and then they should continue to have a screening mammogram every year. And we do have a lot of patients who ask us, at what age should I stop having my mammogram? Is there a specific age that I should not continue to have it? And actually, there's not. As long as you are living a healthy, active lifestyle and you would be willing to seek treatment, we feel that you should continue to come and have your mammogram every year.
That's a great information. And you know, Cindy, it's so important for everyone to get it, and some people are just not able to get it. For people who might not have insurance, or their insurance doesn't cover breast health, what are some of the options for them? So we want to make sure that they get it as well.
Yes, we do. So Covenant has been very fortunate in that we have something called a patient care fund. We've had generous donations from people, and so we've been able to fund a free breast cancer screening program. And so patients who do not have health insurance, or if their health insurance does not cover a screening mammogram, they can give us a call, and we can talk with them about getting them signed up for one of our free mammograms, because we don't want anybody to go without a mammogram. So they can call the Covenant Breast Health Center, and they can ask to speak to a nurse navigator, and we would be happy to talk to anyone about getting set up for a free screening mammogram.
I'm sure so many people have just done a sigh of relief by hearing that. Thank you for that information for people out there. Now, if someone is diagnosed with breast cancer, Cindy, it's important to know that they aren't alone. So what are some of the services that Covenant offers?
So that's a great question. Along with our team of physicians that are here for patients who are diagnosed with breast cancer, we also have support services. We have nurse navigators, and we are here to provide patients with educational materials, let them know what community resources there are out there to support them. We can answer questions, make sure that you fully understand your breast cancer diagnosis. Once you've met with your doctor and you have a treatment plan, we can review that treatment plan. Sometimes there's additional imaging, additional testing that needs to be done, and we can help you understand why that needs to be done and what that will all entail. We also have 2 dedicated social workers here that will meet with patients individually to discuss their social needs that they may have after a breast cancer diagnosis. And not only do our social workers meet with patients individually, but we also have support groups here. We have 2 women's cancer support groups that meet once a month, and we also have cancer support group for any cancer patient, and they can bring a caregiver with them to that support group as well. So our social workers do facilitate those groups that meet once a month. We have a clinical dietitian. We know that whether you are looking for a nutrition information on prevention, or maybe you're heading into surgery, or maybe you're needing chemotherapy, radiation, that dietitian can meet with you and help develop a specific nutrition plan for you. We have a financial navigator here. So if you are having issues with your insurance, or you want to know if there's additional services out there to help you with financial situations, she can meet with you to discuss those as well. And lastly, we have oncology, exercise, and yoga classes for our patients as well. So whether maybe you're finishing up with some treatment and you're experiencing some fatigue, or maybe you're looking to get back into an exercise routine or start an exercise routine for the first time, we can get you signed up for those classes and get you put into a exercise program that's tailored specific to you and your needs.
And Cindy, I love it that you're targeting the entire patient, mind, body, and soul, which is so important when you're fighting cancer, to know that you're not alone and you have support that's out there.
Yes.
So let's get back to the basics, Cindy. How does someone actually schedule a mammogram?
So you can contact a nurse navigator, or you can contact our breast health center, or the Covenant scheduling department, and all of the contact information can be found on our website. And whoever you get at Covenant, we will get you to our scheduling department to make sure that you get your mammogram scheduled.
And that's the same thing if you need to use any of those free mammogram services as well?
Yes, if you are looking for a free screening mammogram,
yes,
just give our breast health center a call and ask to speak with the nurse navigator, and they will get you transferred over to us, and we'd be happy to talk with you about getting that scheduled as well.
Cindy, thank you so much. You have really given us information that we can all use. We appreciate it. Thank you so much. Covenant Healthcare is there for the entire patient. Thank you, Cindy.
You're welcome. Thank you.
Of course, you're welcome. If you'd like any additional information about today's topic, just head on over to the Hot Links page. That's at WNEM.com.